Alright guys, we're here at White Mountain Chiropractic and Rehab in Rinch, New Hampshire. We have soon-to-be Dr. Matt with us today. He has been suffering from some kind of left thoracic paraspinal pain for about 2 years now after a workout, so it's something that seems like it might be a muscle strain. Hasn't been able to get to the bottom of it, so we're going to use him today to sort of demonstrate what a typical Graston technique progression looks like. So we'll have Matt get on the table face down. So we've already sort of screened Matt. He's a current chiropractic student who gets frequently screened, so we know that he's a safe candidate for this technique. Some of the primary contraindications would be any vascular pathologies and medication for those sort of pathologies, like a blood thinner, and we know Matt's not on any of those, correct?
Right.
Okay, good. So what we're going to do here today is we'll start with this will be sort of what the first treatment looks like, very basic, no real movements, just sort of a static treatment to make sure that the patient is going to respond okay. We follow up with them in subsequent visits and get more aggressive accordingly. So I'm just going to give him a gentle stretch here. You're okay in that position, Matt?
Yeah.
Alright, so we'll leave him here, stretches out the tissues a bit. These are our instruments over here, so I'm going to start with this larger one here just because of the area that we're working in. It's scarier than it looks. We're not going to use a whole lot of pressure to start. So we'll put on some emollient so the tool will sort of slide along the skin. The idea behind Graston technique is that we're looking for adhesion, so if you kind of think of a sausage, which is the best analogy I have currently, we have the sausage meat and then the casing on top of that. So think of the sausage meat as a muscle, and then the casing on top of that is very similar to what a material in our body is known as fascia, which envelops all of the muscles and sort of separates the skin and then the muscle. So you think skin, fascia, muscle, and after an injury those tissues can sort of adhere, and we're going to use instruments to detect those adhesions, and it sort of reverberates back, giving some vibration through the metal instrument, and then we know we can focus in that area a bit and more or less iron out those tissues so we can get the tissue sliding back and forth as they should. Alright, so we'll just start nice and easy here, and we'll give Matt permission to let us know if this is reaching more than a 3 out of 10 pain. We kind of make sure to hit different directions as we scan the area. Come from the opposite side here. Doing okay with this, Matt?
Yeah.
Okay, so Matt, I'm going to kind of walk my thumb up here. You say when we get to that sort of sweet spot for you. Okay, so not a big surprise. You can see that the scanning instrument sort of picked up the area that's bothersome. I'm using the same pressure from here to here. The place that we say sort of lights up is where the adhesions live, and it's sort of smack dab where Matt's complaint is. So no surprise, very consistent with his complaints. First visit would go just like this, a few more minutes. We'd send him home, follow up, and as I said, get more aggressive the next visit. We're going to sort of jump right into that next visit now with Matt because, as I said, we're familiar with this case and we know he's a good candidate for this treatment. So while we're here, we're going to take this arm, starting here, and push forward, and then we'll come back and we'll push forward again. The idea behind this is that the fascia should be in a linear fashion with the way that the muscle extracts and contracts. So in this particular area, we have a few different muscle fibers, some going superior to inferior, vice versa, and some lateral to medial. So the idea is that when we break up that tissue and new tissue is formed, we want to make sure that it's going to happen in the same direction, if you will, as the muscle fibers. So in order to do that, we have to give for the academics, the myofibroblasts, information on how to build this new tissue. So we'll do that with the rehab as we treat. So I'm going to get a little bit more emollient here, so that's kind of drying up. And now you'll see some more redness happening as we move forward, because I'm going to get a little more aggressive, because this is what we consider our second or third visit. So Matt, go ahead and sort of get into position, throwing a punch forward. Good. And back. And continue to do that. And again, speak up if we're getting a little too aggressive. Probably not picking it up on camera, but you can feel and hear some... Sure, Matt can feel it. He can tell you that. You can see he's getting red pretty quickly here. But you can feel and hear, keep going, pal, the tool bouncing around and the adhesions, kind of the tool grazing over the adhesions. And I'm going to trade these handlebars in for a little bit of a smaller tool, so we can make sure we're hitting all directions. And as I said, this fascia should be in the same orientation as the muscle fibers. When we have a sprain or a strain and it's not addressed correctly, what fibers should be like this often will heal something like this, so you lack that tensile capability. And in the fascia, it's more and more popping up in the literature that it's loaded with the receptors that report back and forth to the brain about where our muscles are in space, the same receptors that allow us to close our eyes, find our mouth if we need to eat or drink when we can't see. So that same idea, if the fascia is not oriented appropriately or it's not gliding due to lack of hyaluronic acid, we will be giving our brain poor information about where our muscles are in space, and therefore we're going to have dysfunction. So I want to save the third visit for today on this video, so we're not going to beat Matt up anymore. And what we'll do is, Matt, we'll have you go ahead and step off the table. Now we just get a little more aggressive with the rehab portion. We're not going to dig in too much further with the tool, because we're already actually, sorry Matt, we're going to have you just stand here. Let me demonstrate for you actually quickly. So we're going to have Matt leaning over the ball. We'll lower this table a bit in the relaxed position, and then we're going to come forward and we're going to come to the right. In this case, because we're dealing with left paraspinal musculature. So down here, up, and to the right. Good. Okay, so leaning forward, totally relaxed position first, arms down. Actually kind of back a little bit. And now we'll kind of roll forward, up, and to the right. Good. So we're taking this muscle sort of into the shortest position and then to the longest position under stress. And in this third, fourth visit, what we're looking to do is sort of give Matt a provocative motion. We already know, based on our pre-screen, that Matt feels discomfort in rotation. So we want to essentially, the idea is to treat the problem where it is the biggest problem. Good. Alright, and Matt can relax there. We're going to use some BioFreeze. It just sort of helps get rid of the emollient, because we got him pretty good today for the video. We're going to put some Kinesio Tape on here in an edema reduction type fashion. So we're going to use this spray here. 1, 2, 3. This will feel good. There's really no healing properties for it, but like I said, it gets rid of the kind of lotion on the skin, and it just gives a nice feel for patients after we treat them. So we'll wipe that down. So there are several different reasons that we can use Kinesio Tape. As I mentioned, this is going to be an edema reduction. We can tape in a structural fashion, but the idea here is that we will put the tape on with a fair amount of stretch. So as it sits on the skin, pretend that this is the skin, As we stretch the tape and lay it down, it'll automatically want to sort of pull the skin close together, which creates a pressure gradient that allows the lymphatic fluid to flow. So if you've ever seen this on an athlete before, that's usually for a structural or neurosensory application. In this application, you will see used over a bruise, and many times somebody has a significant bruise, we apply the tape like this, we peel the tape off the following day, and the regions underneath the tape are largely bruise free. So bear with me here. So we're actually going to just get a little fancy and do a little bit of a mechanical application as well while we're doing the edema reduction, because why